Tissue expansion methodologies for breast cancer reconstruction have evolved from the desire to restore a woman's quality of life following the devastating effects of mastectomy. The main challenge for the breast surgeon has been to achieve an aesthetically pleasing result in a manner that is simple, efficient, and comfortable for the patient. To date, conventional saline expanders have produced suboptimal results, and the process is long and time-consuming for both the patient and physician. The method of filling current expanders by needle injection is uncomfortable for the patient and requires frequent office visits. Patients often report that discomfort from bolus, inflate until there is tightness, injections, can last for several days, and require prescription pain medication. The prospect of having to endure months of weekly injections and tissue stretching just within their pain tolerance is a cause of dread and anxiety for many women. The time and resources required for saline expansion result in higher costs to the physician, their office, and the healthcare system. While reimbursement is federally mandated for breast reconstruction, the multiple office visits for these periodic in-office expansions are not, which can lead to lost productivity and increased resource requirements. Current expanders are designed with a single, expandable outer shell, which can produce a non-anatomical shape, resulting in uneven expansion. The need for a predetermined shape design that emphasizes lower pole projection in order to create a naturally shaped breast has long been recognized by breast surgeons. With these unmet patient and physician needs in mind, Air Expanders has designed a novel breast tissue expander that offers solutions to the limitations of conventional expanders. With the Air Expander system, controlled daily expansion is made possible, which can lead to shorter reconstruction times for patients with an easy-to-use, needle-free device. With emphasis on simplicity, efficiency, reliability, and safety, the Air Expander system is comprised of an implantable expander made of a soft outer shell and an inner expansion chamber, which has a predetermined anatomical shape, allowing the expanding breast to appear more natural as the targeted area is inflated. When activated, a small dose of CO2 is delivered to the implant. CO2 is commonly used in millions of medical procedures around the world. The implant is activated with a remote handheld controller, which provides power to the implant, allowing flexibility and greater patient control in the expansion process. With the push of a button, a 10 cc inflation dose can be administered simply at home on a daily basis, eliminating the need for inconvenient office visits and needle injections. Patients can dose up to 3 times a day as prescribed by their doctor. The Air Expander system provides the patient and physician an efficient and comfortable method of expansion, taking as little as a few weeks to complete, as reported in a clinical study conducted by the company, versus months using conventional saline expander technology. This means that the patient can get to full expansion and schedule her permanent implant exchange more quickly, allowing her to regain her body shape and feel whole again. The Air Expander system eliminates the need for injections, which can save time and reduce costs, anxiety, and resources required to manage the patient during the expansion process. Having a predetermined anatomical implant shape paired with controlled daily expansion, the results have been shown to be aesthetically superior and more uniform than with saline expansion devices. The Air Expander system uses up to 3 physician-prescribed 10 cc doses per day, while conventional saline expanders can require weekly physician office visits to inject a bolus amount of saline. When compared to other methods, such as conventional saline expanders, the Air Expander system outperforms the competition, achieving full expansion in weeks versus months. Using the Air Expander system, expansion can be conveniently performed at home or work. With a simple push of the button, the physician-prescribed dose is delivered, and the patient can continue on with her daily activities. By enabling patients in the midst of their cancer recovery to play an active role in their return to a normal body shape, The Air Xpander system allows women to put expansion control in the palm of their hand. Physicians can now delegate more activities to their staff and move on to supervise and evaluate other patients in their care, versus spending additional time and resources inflating patients' conventional saline expanders. For needle-free expansion, greater control, shorter reconstruction time, a more uniform shape in an easy-to-use and practice-efficient design, the Air Xpander's tissue expansion system is a true solution for both the surgeon and their patients.